Good afternoon. Thank you for joining us today. My name is Ken Lawrence, Montgomery County Commissioner. I'm joined today by my colleague, Dr. Val Arkush, the Chair of the Montgomery County Board of Commissioners, Lee Saltesiak, our Chief Operating Officer, and Josh Stein, our Solicitor. We are going to start today with an update on the 2020 election and the counting that is taking place here in Montgomery County. As of right now, we are showing strong overall voter turnout at 74%. And here's where we are with the numbers. For in-person voting, 100% of our precincts reported early this morning, and all those results are in and on our dashboard. For mail-in ballots, we had 279,956 people apply for a mail-in ballot. Of that number, 243,408 have been received by the county. So far, we have counted 193,408 of the approximately 243,408 mail-in ballots that we have on hand. So that's 79% of the ballots that we have counted. And we expect that these numbers will continue to evolve as the military and overseas ballots continue to be received, and they can be received up until 1 week after the election. Our online results dashboard will continue to be updated throughout this process, and all results are posted at the following web address: montcopa.org/election 2020. Our voter services staff will continue counting 24 hours a day until the count is complete. We estimate that this will take up to 24 hours until we are through the mail-in ballots we have received up to 8 p.m. on election night. We again ask for your patience as we work to conduct this count as efficiently and safely as possible. And we remain committed here in Montgomery County that we will count each and every ballot that we have received. And now I'd like to turn it over to Dr. Val Arkush, Chair of the Montgomery County Commissioners, to provide an update on COVID-19. You're muted, Val.
Thank you, Ken. So good afternoon, everybody. As you know, today is Wednesday, November the 4th, week 35 of COVID-19 here in the county. Since our November 3rd press release, we have 131 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 14,346 cases. These positive cases are a result of a positive test for the virus, not from the antibody test. 4 of these cases are from long-term care facilities. 127 are from the community. Now, interesting in our results today, 99 tests are from the last 7 days or less. 2 tests are from 8 to 14 days ago, but 29 of the tests are more than 14 days old. And this represents cases from a commercial testing site that were uploaded quite late. And then 1 of our tests has an unknown date. These positive individuals are from 38 municipalities. All 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 1 year old to 94 years old. And as always, you can check montcopa.org/COVID-19 for updated geographic and other information. Today, we have 71 females and 60 males. I am sorry to confirm that 2 additional Montgomery County residents have lost their lives to COVID-19, which brings us up to 842 deaths confirmed positive from COVID-19. 1 individual was 61 years old, the other was 93 years old. Both individuals died at a hospital. Overall, 447 females and 395 males have passed away from COVID-19 in Montgomery County. They ranged in age from 36 years old to 104 years old. Their self-reported racial breakdown is 19 Asian, 3 Asian Indian, 3 Asian Korean, 105 African American or Black, 336 white, and 376 that we do not have information on. For many weeks, we've discussed, and public health experts have predicted that we are in the midst and are in the midst of a fall surge in COVID-19 cases. Our positivity rate is increasing. Our 14-day average positivity rate is now 4.39% as of last Friday, October the 30th, compared with 3.16% on Friday, October the 23rd. As a reminder, a positivity rate below 5% is considered suppression of the virus. While not consistently above 5%, this graph showing the daily positivity rates from October the 17th to October the 30th does show that the county is above 5% on 4 of those days. So we do just want to make sure that people are taking this quite seriously. Additionally, our hospitalizations continue to increase. Today, 101 individuals with COVID-19 are hospitalized in a Montgomery County hospital, an increase of 31 individuals from last Wednesday and an increase of 62 individuals from 2 weeks ago. 7% of these individuals are requiring a ventilator. As a reminder, both hospitalizations and deaths lag behind cases. And to illustrate this, we're showing some data, our data, from mid-March to mid-June from earlier this year. This shows the increase in cases, represented by the green line, followed a couple of weeks later by the increase in hospitalizations, represented by the purple line, followed a couple of weeks later by an increase in deaths, represented by the red line. Please take this increase in case numbers seriously. We are already starting to see a rapid increase in hospitalizations. Yesterday, I convened a meeting with our Montgomery County hospitals to discuss COVID-19 surge planning. Currently, no hospital has unmet needs, but they did ask me to remind our entire community that their staff has never stopped caring for COVID-19 patients. This work is extremely labor-intensive for all hospital workers and does expose them and their families to some risk. Please remember these workers as you go about your day and do everything that you can to help keep our hospital numbers as low as possible. Why are these numbers rising? Well, cooler weather has 2 impacts. First, the virus can stay airborne longer in colder air and thus is more easily transmitted. And second, cooler temperatures tend to send people indoors for gatherings and other activities. Social gatherings, sports, and recreational activities continue to be our biggest sources of spread here in Montgomery County. I'd like to share with you a story from our contact tracing team. Currently, we are investigating an outbreak that started with 3 adult ice hockey teams that play at Hatfield Ice Arena or at the Oaks Center Ice. There are now 17 positive individuals from 3 different teams. Some of the positive individuals coach other teams, where there are now at least 6 additional positive individuals across 5 different junior teams. And those cases are still being investigated, and there may be more positive cases. As a result of the 23 positive cases from these 8 teams, 73 close contacts are now in quarantine. A common thread among all of these positive cases is the lack of mask wearing and social distancing, particularly on the bench. What can we do to flatten this surge? Don't leave home without a mask and put it on whenever you are within 6 feet of someone who is not in your household. Keep that 6 feet of distance from anyone not in your household. Keep your hands clean and away from your face. Get tested if you need to or want to. Please cooperate with contact tracing. And what would be so incredibly helpful would be to download the COVID Alert PA application. This free app can protect you and your family by letting you know that you may have been exposed to COVID-19, allowing you to seek medical advice early, get tested, and protect your loved ones. It collects data anonymously, so you won't know who exposed you or exactly where that happened. Same thing, if you expose someone else, they won't know who exposed them or where it happened, but it is a very easy tool that we can all use to help keep our community safe. Regarding testing, our testing continues to go smoothly in our 11th week with Mako Medical. With rare exceptions, the county's results are available within the contractually promised 36 hours. I do want to remind people being tested that at the testing site, you will be given information on how to register to get a text or email from Mako as soon as your test result is ready. I encourage you to sign up for that notification. This is the fastest way to get your result as soon as it is available. Our testing capacity is currently at 75 tests per day, Monday through Friday at 4 testing sites, and 50 tests per day at 2 of the testing sites. The graphic that you can see has the updated testing hours for Ardmore, Lansdale, Norristown, and Willow Grove. These 4 sites have expanded their hours in order to allow for the 75 tests per day at each site, Monday through Friday. So now in total, the county has 400 tests available Monday through Friday across the county-run testing sites. We continue to have strong availability of testing. So I continue to urge anyone who wants or needs to be tested to get tested. The more we're able to test our community, whether you have symptoms or not, the more we will know about what is happening across the county and be able to quickly suppress any outbreaks. As a reminder, the 6 county COVID testing sites do not require a car to be tested. The sites provide testing at no cost to you, though insurance will be billed if you have it. We do not require a healthcare provider's order, and we will test individuals of any age who need or want to be tested. These sites do require an appointment. All appointments are made on the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County or works or goes to school in Montgomery County. I want to emphasize that you will not be billed or charged a copay for a COVID-19 test done at a county-run testing site. To register for a test, you can go online at 8:30 in the morning, not at 8:29. It opens at 8:30 at moncopa.org/COVID-19. Click on the green County Testing Information button at the top of that page. You can also make an appointment by phone beginning at 8:30 in the morning on the day that you would like to be tested. That phone number is 610-970-2937. And Language Line is available at that number for a variety of languages. For the 14-day period ending October the 30th, 33,063 Montgomery County residents were tested, which is an increase of 2,459 people being tested compared with the 14-day period ended October 23rd. So it's great to see that our testing continues to go up and want to continue to encourage people to do that. So we'll go now to some of our graphs that we show you every week. First is our date tested graph. Just as a reminder, this graph shows by the gray bars in the background the positive tests on that particular day. Then we have in the sort of darker red and darker blue lines the 7-day average of those positive tests. And in the more pink and light blue lines, the 14-day average. Down at the bottom, the orange and yellow lines are the 7 and 14-day average from our long-term care facilities. And you can see, it's particularly illustrated on the zoomed in version of this graph, that our 7-day averages have really picked up quite a bit over the last couple of weeks. And we can see our 14-day averages, of course, rising to meet them. So just another reminder of the fact that there's a lot of virus out in our community, and it does continue to spread. In terms of the ages, it's time we're due for our monthly depiction of the number or the ages of individuals who are getting COVID-19 in the county. Please note the fact that the increase is now across just about every age group, 64 years of age and under. Of note this week is that individuals 55 to 64 years of age are experiencing an increasing share of cases for the first time since April. So again, just want to remind everybody that the virus is affecting all people of all ages, all across our county. We're seeing increases in almost every single community. And our goal here is to keep this surge fairly flat as we can, so that our hospitals do not become overburdened and we can continue to support our school districts who have chosen to bring kids back to school and support our businesses, which are trying so hard to get back on their feet. Just a couple quick announcements. First is the Montgomery County Office of Public Health is continuing to run their no-cost flu clinics. These are walk-up clinics. There are 6 clinics that are open every Thursday in Pottstown, Green Lane, Willow Grove, Lansdale, Norristown, and Ardmore through the end of November. The flu shot will be offered at no cost to individuals aged 6 months and older who live, work, or go to school in Montgomery County. I'm pleased to share that to date, 2,932 individuals have been vaccinated at these clinics. So that's great, but we have a lot more vaccine available for you. So please take advantage of this very quick and easy option to get your flu shot. As a reminder, the flu shot will not protect you from COVID, but it will protect you from getting the flu. It will reduce your chances of getting the flu. And if you do get the flu, it will decrease the chances that you'll need to be hospitalized. So this is another step that you can take to help protect our hospitals and everyone who works there. And finally, I just want to announce that the Office of Public Health has posted guidance for the Thanksgiving holiday. There's a fair amount of information there. And primarily, this information has been divided into risk categories. And a lot of just common sense around this. The highest risk activities would include large indoor gatherings that include people that are not part of your household. So again, please do take a look at that. We're asking people to be very, very cautious over the Thanksgiving holiday, as I suspect that our cases will continue to be on the uptick by Thanksgiving, and particularly with people traveling from other parts of the country where the virus is surging even more significantly than it is in our region. It definitely will increase everybody's risk. Before we go to questions, I will announce that our next virtual briefing will be next Thursday, not next Wednesday, but next Thursday, November the 12th at 3 p.m. This change is due to the observance of the Veterans Day holiday next Wednesday, November 11th. And with that, we'll be happy to take questions.
We will start our questions this afternoon with Jim Melwert from KYW News Radio.
Just one quick question for you, Ken. I think you said you expect to finish within 24 hours, finish counting. Is that correct? And also, do you have any idea what that might have looked like if you'd had 3 days or so to pre-canvass? You're muted.
Yes, I said it would take us about 24 hours if things keep progressing well. And certainly if we had been able to pre-canvass and start actually counting at 7 a.m. on election day, we probably would have been done today. So it would have been a lot quicker. It would have helped to have had that pre-canvassing period before election day.
I'm good. Thanks, Ned.
Thank you, Jim. Next, we'll hear from Christopher Ullery from the Bucks County Courier-Times.
Yes, thank you. I had a question on the case on the 4th Congressional District hearing today. what exactly, is there an estimate to when that ruling might be made? I believe there's some supplemental briefs coming in that are due on Friday. And as of right now, either Ken or excuse me, Lawrence or Kush could comment on, their feelings on where this case stands right now after the judges heard the witness testimony earlier this morning.
Yeah, we believe our process is sound and permissible under the election code. We presented testimony in court today, and we expect a decision in the coming days.
All right. Thank you very much. I'll go to follow-ups after you go through everybody.
Thank you, Christopher. Next, we will hear from Ellie Silverman from the Philadelphia Inquirer.
Sorry, I was muted. Thanks for having this. Is there anything that you want to remind people in terms of with those 24 hours, what they should be looking for as candidates call Pennsylvania for themselves?
Can you repeat the question for me, please?
Yeah. Do you want to anything you want to remind voters as votes are still being counted and candidates are calling the state that they want it, but there's still all these votes being counted? Anything you want to remind people about the process?
We can't control what candidates declare or don't declare. We are committed here in Montgomery County to making sure that we count every ballot, and we will continue to update our website regularly until we get there. So we would just ask for people to be patient. This is a normal part of the process. We knew we would have more mail-in ballots, and we just need time to count them.
Thank you.
Thanks, Ellie. Next up, we have Miles Watkins from the New York Times.
Hi there. Sorry, no questions on my end. I was trying to listen in and hear any updates regarding the vote count.
Okay, thanks, Miles. Next up, we have Deanna Durante from NBC 10.
Hello. So I have a question on COVID, believe it or not. We have learned that Lower Moreland shut down for 2 weeks today, the school district, because of a number of cases with students and teachers, and they're hoping that 2-week period will be able to eradicate or at least bring down their positivity rate. You're now talking about the ice hockey situation. Where else are we seeing, if you can be that specific, where this kind of spread is happening, particularly with sporting events and social gatherings and children?
Sure. So, I just want to clarify that we're simply asking schools to go back to 100% virtual. And they are all prepared to do that. They all knew out of the gate as the school year began this year that they might have to revert to 100% virtual. And so
closed was the wrong term then. Sorry, I apologize. They went to virtual, but they shut down the buildings. So I apologize.
So I've been trying to give specifics as best I can during these briefings every week. In general, it is indoor social gatherings, most of which are private. So it's difficult for me to be more specific than that. But it's these smaller gatherings for the most part in private homes. I will say that most of our commercial locations and restaurants are being extremely careful. They want to stay open, and so they're following the mitigation. They work very collaboratively with our team from the Office of Public Health, and we have not seen a lot of problems in those types of places. It's more the private gatherings and then exposure on these sports teams that we're seeing are our biggest challenges.
Any consideration being given to what we've seen happen in other areas of the state where there are limits placed on how many people you can have in your home or how many people you can have in your backyard, those kinds of restrictions?
We're not looking at specific numbers right now, other than what the Office of Public Health, through our Board of Health, already has in place, which is an outdoor limit of 250 and an indoor limit of 25. However, and that is of course in a commercial business. However, there's a process in place that if a commercial business has, for instance, a big ballroom or that sort of setup, they can apply for a permit by submitting a health and safety plan to our Office of Public Health, who will work with them to see what is possible in their particular location. And then they can get an approval for instance, a set of events that meet a certain set of criteria. So we're trying to make this as straightforward and as simple as we can for the business owners, but also develop that relationship with them, be consistent in our approach to indoor gatherings, and be able to support them if they have any questions or should they have any problems. And so far, that's been working quite well with a number of businesses.
Two more quick questions. As colleges and universities wrap up for their semester, many across the country are talking about not coming back after Thanksgiving. Have you had any conversations locally with our colleges and universities, and have we seen any spread within schools?
So I personally haven't spoken with them too recently, but our Office of Public Health is in regular communication with them. They have a contact person there, and I am not certain what they're planning for the post-Thanksgiving time period. I do think that at least several of them are not having students come back after Thanksgiving, but I'm not 100% sure. Again, we have not seen a lot of spread at our county colleges and other higher learning facilities. They've worked very closely with our Office of Public Health, and they have put into place very strong plans with good mitigation measures. And for the most part, those have been successful so far. So again, I think this just underscores the importance of communication with our Office of Public Health. We are here to work with people. We absolutely want to try to get to yes, if at all possible. And we found that collaborative approach to events and other things has been pretty successful. So I just want to encourage anyone who's interested to take advantage of that.
Thank you.
Thanks, Deanna. Next up, we have Marcus Espinoza from Fox 29.
Hi, how's everybody doing today? I hope well. So I have a question and just a couple quick follow-ups. When exactly did you start counting ballots?
Lee, do you want to take that one?
The county started processing and scanning ballots at 7 a.m. on Election Day when the pre-canvass was allowed to begin. Okay,
and currently, are you only dealing with the mail-in ballots at this point? What ballots are you counting? In other words, have Election Day votes already been counted?
Yes, all the Election Day votes have been counted and are on our website.
Okay, and then just real quick, can you express why it's taking so long? I know you mentioned it a bit before from another question, but really explain what's taking so long to get this counted.
I wouldn't say that it's taking so long. I would say that we have over 200,000 ballots to count. We had to remove those ballots from 2 envelopes before we could begin to count them. But our people have been working tirelessly around the clock, and they're getting the ballots counted.
Okay, thanks so much.
Thank you, Marcus. Next, we'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, commissioners. I have a couple election questions. Did you receive any mail-in ballot today in the county? Did any more come in than what you had received yesterday?
Yeah, we received 153 ballots in today's mail.
Okay, and the deadline is you can still receive ballots tomorrow and Friday until 5 p.m. Is that correct?
That's correct.
And with the ballots that were received yesterday and the additional 153 today, there are still some ballots out there that could be coming in over the next 2 days. Is that correct?
That's correct.
There's still some out there. There's still some out there, right?
Yes. Yes.
Okay. And now, in general, how do you think the county has handled this election? I mean, there was a lot of talk about potential chaos with this election, with the number of mail-in ballots, and the fact that it was a presidential election, and more people would be coming out to the polls. How do you think the county handled it in general? And were there less problems at the polling places than you had anticipated?
I think the county has done a superb job handling this election. We should all be very grateful to the county staff who's been working tirelessly on this. We have functionally been running an election for a month now, since ballots went out. With our drop-off locations, with our satellite offices, we've nearly tripled the size of our voter services staff. We had 298 polling locations when we only had 140 in the primary. All of those were staffed. So I think the people of Montgomery County should be very proud of the way this election was run. We did not see any significant problems at the polls yesterday. There was no trouble, issues, some normal election day things. But I'm just tremendously proud of our staff and what they've done to hold up this election.
Okay, and there was nothing, the county's district attorney's office had a tip line available for people to report things potentially of a criminal nature. Was anything reported of a criminal nature at any of the polling places, as far as you know?
I would refer you to the district attorney's office to answer that. I am not aware of anything, but you should contact the district attorney's office.
Okay, thank you. That's all I had.
Thanks, Carl. Next, we'll go to Katie Meyer from WHYY.
Hi, how are you guys? I would also like to ask about those late arriving ballots. So let me find where I just wrote that down. You said 153 were received in today's mail. How many total, counting after 8 p.m. yesterday and those 153 today, did you receive after the deadline?
I believe that 153 represents the total number so far that we have received post 8 o'clock on election. There were ballots that arrived late in the day from the post office at 7:30, and then our drop boxes that were collected on election night at 8 p.m. All of those arrive back at voter services and are considered to be on time, and then those have been added to the total count.
And those ones that are getting in late and are going to be put into that separate sort of late box, are those being added to the total count too, or are they just putting a lid on them?
We'll follow the Department of State guidance on how to separate and count those ballots.
Well, the Department of State has said that you can count them, but they have to remain, as they said, segregated. So are you counting them?
So we will follow the Department of State guidance on counting and separating those ballots.
I mean, Ken, I think, are you counting them? Because the reason I ask again is because some counties have done their own thing and they said that they were not going to count them. So I just want to make sure that,
So we are going to follow the Department of State guidance.
Okay. And are they also being kept separate from the rest of the ballots? Like, are they in like a different place? Are they being stored differently?
Yes.
Okay. Thank you.
Thanks, Katie. Now that we've concluded our opening round of questions from each of the reporters, I will invite our press group to ask any follow-up questions. I'd ask that any reporters that are interested in asking a follow-up question at this time, please take yourself off of mute, and that will be the way I'll know to call on you. Thank you. Okay, we'll start our first questions here in the second round from Christopher Ullery.
Thank you very much. Getting back to the congressional 4th district case, I was going through this, is probably a question for Lee, but I was going through the 33-page filing from the county, sort of giving the argument against Barnett's claim, saying that before Election Day, ballots must be inspected and cataloged in the district register to show the elector who requested an absentee or mail-in ballot has in fact voted. This is sort of an informal inspection as required. I'm wondering if you could clarify, where's the line drawn between that informal inspection and pre-canvassing? How are these potentially deficient ballots identified with respect to that? I think one of the questions that came up for me was that seemed like the naked ballot issue might have been a part of that. And I just figured you had to open up the envelopes to see that, but I'm not sure. Can you go into that inspection process and how specifically why that isn't pre-canvassing?
I did for a few hours this morning in court, but I would at this point defer to our solicitor if we should really go into anything more deeper here.
Yes, so pursuant to the Department of State guidance, we do a visual review of the ballots as they come in, obviously making sure that they are, for things such as, are they actually, in fact, for Montgomery County voters, or are they from other counties? And for other potential defects, which are facially visible, and so that we can deal with those as they come in. So that's sort of thing that as long as you can see it on the face of it, whether it's missing something or whether or not you can see right through it and see that there's no privacy envelope inside, those are the sort of first level inspections that can be done without having to go into any specifics about the qualifications of the ballots themselves.
So so would it be fair to say these were suspected to be deficient, potentially with those secrecy ballots? It sounds like to have them in your hands, it might be obvious to the poll workers there. Okay.
Yes, it's issues that are just readily visible from a quick review of the ballots themselves or the envelopes themselves.
And if I could, was there any, as far as the way that Montgomery County handled those initial inspections, was that just sort of off the county's own interpretation of the election code? Was there guidance from another county that may have influenced that? Just kind of trying to get an idea of how common what Montgomery County did might be in other areas. As the judge had raised to the attorneys for Barnett, you could have gone to Berks County and said, hey, why aren't you doing what Montgomery County is doing? And I guess I'm kind of wondering, how different all these counties are working right now.
So obviously our first avenue in those cases is to look to the Department of State for them to issue guidance on these matters. And in this case, they did issue guidance regarding certain facial defects and what qualified as facial. But certainly a number of the counties, particularly counties that neighbor one another, are oftentimes in communication regarding how they are dealing with issues. I can't say specifically what issues may have come up in that, but I know that we do talk about what we do in specific situations so that we can all try to as mirror each other as closely as possible.
And if I may, just one final question, is probably for the commissioners there, but sort of piggybacking off of what Mr. Espinoza had asked, as far as the time it takes to count these ballots. I believe that Leah testified that there's 93 ballots in question at this point. That's a minute number. And I think it might be fair to ask, why is the county fighting so hard? What's at stake here? Why is it so important to fight this case?
I think it's important that people have the right to vote. And I think what we are doing in this circumstance is helping people make sure that they have the right to vote.
All right, that's all I have. Thank you very much.
Thank you, Chris. Two other reporters indicated that they had questions for the follow-up segment here. The first is Ellie Silverman from the Philadelphia Inquirer.
Hi, I've got a question about Thanksgiving and COVID, if that's all right.
Sure. We can't hear you, Ellie, if you're talking. Still can't hear you. You're not muted. Oh, now you're muted. There we go. I can hear you now.
Oh, you can hear me now. Great.
Yep.
Sorry about that. I wanted to know what you would say to a family that maybe wants to gather 10 to 12 people around the dinner table for Thanksgiving, and they're from 3 or 4 different households, and they think they're, taking precautions by opening windows or maybe even getting a COVID test or just trying to limit their exposure leading up to it, as I'm sure plenty of people are considering right now.
Yeah, I know this is a challenging time for so many families. It's, so many people's absolute favorite holiday. So what we have presented in our guidance are activities that are low risk, moderate risk, and high risk. And what you describe in your hypothetical gathering, assuming that there were people there from several different households, that would be, and they were indoors, that would definitely fall into more of that high risk category. So there's a couple ways to think about it. One would be if there's any way that it could be outdoors, maybe with those heaters, that type of thing. To have it be outdoors is always going to be safer than indoors. But otherwise, I would certainly ask people to really think twice about doing something like this. Maybe they can do something together on Zoom or in other creative ways. We've got suggestions up there about maybe making some of your family's favorite dishes. Maybe each person can make one of those dishes, and if they live closer to one another, they can deliver that with no contact delivery to each other and then share that meal via Zoom. There are ways to do this that are lower risk. And so I would really urge our families to think about it. Here in Montgomery County, we're still below 5% positivity. I think all of our surrounding counties at this point are above that suppression level, some quite a bit above that suppression level. So particularly if people are coming from our surrounding counties, that just the chances that they might be carrying virus are even higher. So if families can come up with some more creative ways to celebrate, but do it from a little more of a distance, that would be the safest strategy.
Thank you.
Thanks, Ellie. Next, we'll go to Marcus Espinoza from Fox 29.
Hey, just real quick, again, can you say how many ballots are left to count? What's the total number as of right now? About.
Who has a calculator here?
I have a calculator. Do you have the
All right.
numbers?
Do you? Yeah.
I'm a doctor. I have a calculator. What can I say?
Approximately 50,000.
Okay. And then you said within 24 hours you guys will be finished, but is there any chance of getting an update tonight at all if it's going smoothly?
We've been updating it every hour, so we'll continue to update.
Thank you.
And the URL for that is in the chat. So if you all don't have that, you can grab that now. It's in the chat.
Thanks, Marcus. He was the final reporter who indicated that he had questions during the follow-up round there. I'll ask one more time for any of our members of the media joining us here today. If you have any more questions to ask, please briefly take yourself off of mute, and then you can put yourself back on, and I will call on you. Thank you. Okay, looks like we have no further questions. Thank you all for joining us.